So the question from Paul Hamill was, why are there more cases per capita in rural areas versus urban areas, and does that mean their healthcare systems are going to be overwhelmed? I suspect, Paul, and I haven't looked at numbers directly, that that's being skewed by Grand Island. We also had a number of cases in Kimball that was, and actually we also had a number of cases in Custer County that tend to be really focused around assisted living facilities or nursing homes. And so that's why I think you tend to see spikes up. So for example, you may recall last week, we sent out our National Guard team to Kimball County because we saw that we had an unusual number of cases testing positive out there. So we deployed the National Guard. I think everybody we tested turned out to be negative except for the one person who we knew already had tested positive once. So again, we had a bunch of folks that were associated with a nursing care facility, I believe, but nobody else in the community, at least didn't seem to be that prevalent. Same thing I would say for Custer County as well. We had Callaway, and that was a nursing facility where we ended up moving some of the residents to Great Plains Hospital in North Platte. They were a great partner in being able to get that done. But I think that kind of represents why, if you look at the map, Custer County has got more cases per capita as well. I think it's associated with nursing facilities. So I think there's specific explanations for why it may look like that, but some of the data is maybe being skewed around specific instances. And then the other thing I'd just say, just to kind of finish up the question about are there healthcare systems being overwhelmed, the answer is absolutely not. Again, where we've got the biggest hotspot in Nebraska right now is Grand Island, and we continue to manage that situation. The folks there in Grand Island I know are working very, very hard. The public health people, all the hospital workers, everybody's working really hard. But I think as of this morning, they have, of their ICU beds, they've got, 12 of them are being used, 10 of them are being used for COVID patients. Isn't that roughly correct? And 8 of those are on ventilators?
Yeah, yes.
What are the numbers, Dr. Antonio?
12 on ventilators, 10 of those 12 are COVID positive.
12 on ventilators, 10 of those 12 are COVID positive patients. I believe they've got 21 ventilators in that facility and 16 ICU rooms. So they are, again, certainly they're working very, very hard, but we are managing it, and everybody who needs that care has been able to get that care.
Good time for